Hello, I'm here to talk about recanting in 3 HIV prevention trials. This is joint work with Michael Fendrich at the University of Connecticut and Ralph DiClemente at NYU. Recanting is very common in survey research. All three of us have separately and also to some extent together worked on papers about recanting. So first of all, recanting is reporting a behavior and subsequently denying having ever engaged in the behavior. That is reporting a subsequent logically impossible answer. So Fendrich and co-authors found about 15 years ago that about between 30 and 50%, depending on the behavior and the exact survey, of adolescents recanted lifetime use of marijuana, alcohol, and cigarettes over several years. And their conclusion was that asking adolescents about their lifetime incidence of certain behaviors has questionable validity. I found that a year after reporting sex, virginity pledges, driving under 16, that is probably not legal, tattoos, and for boys, pierced ears, more than 10% of adolescents recanted. Specifically, 11% recanted sex, and neatly that was associated with a new virginity pledge or a new born-again Christian identity. And over half recanted virginity pledges, and that was associated with sexual initiation. Recanting likely results from initial over-reporting, that is exaggerating risk behaviors because it seems cool or they want to seem deviant, concealing behavior subsequently. So the second report is incorrect, or both. And sometimes it really is both. For instance, in my paper, younger boys and older girls were both likely to recant. The younger boys lied about having sex the first time, or they misreported having had sex the first time. The older girls, probably many of them, reported accurately the first time and then concealed the behavior the second time. So in this study, we're looking at recanting of lifetime marijuana in 3 HIV prevention interventions. We harmonized the data and we just looked at the marijuana for this purpose of this presentation. We have 7,600 observations from 1,976 women in 3 trials. And I chose the marijuana question a little bit arbitrarily. We have similar results for these other questions about emotional and physical abuse, oral sex, anal sex, and reproductive coercion. And separately, we had in the final trial, we have questions about we have separate questions about reproductive coercion that only occurred in that last trial, and we looked separately at recanting of those. So these are all three include unmarried Black women in Atlanta. The inclusion criteria was having had unprotected sex in the past 2 or 3 months, depending on the trial. They were recruited at family planning clinics, in 2 cases, by Black women health educators and MPH students. The other one recruited at community settings, and an exclusion criteria was pregnancy or attempting pregnancy. All of the interventions are based on the Horizon HIV intervention that includes elements of cultural and gender pride, condom negotiation skills, and it occurs on 2 Saturdays with booster phone calls. And all the interviews were done by audio computer assisted self-interview. There were some differences, however. They occurred in different years. Horizons was close to 20 years ago. Enlighten was closer to 10 years ago. They had very high participation rates, but they did differ to some degree. Enlighten recruited in community settings, and the reason why is because they weren't able to find enough participants who used alcohol in the past 90 days in clinics, and so they had to move to the community settings. Likewise, because of the alcohol component to Enlighten, they shifted the age range slightly older, and they allowed participants to have children rather than excluding participants with children. And that's again a consequence of having the older age range. So this plot doesn't show recanting directly, but it does imply it indirectly. We have green dots with confidence intervals for Horizon, red for AFIA, and you can see that these two earlier HIV prevention interventions have some drop off in the percent reporting having ever used marijuana, and that represents a pretty moderate amount of recanting. For Enlighten, there's a huge amount of recanting. We have less than half the same people reporting lifetime use of marijuana, and that represents more than 50% recanting, because there were also people who initiated presumably marijuana in this time. So these percentages are net of that increase. We also did trajectory analysis, and we'll be using that as an outcome to see whether we can predict the group membership either in the trajectory, and this was the trajectory background that fit the data the best, of starting almost universally with marijuana use, almost everybody, and then declining more rapidly at the end, versus starting with about 60, a group that starts at about 60% marijuana use and then declines rapidly and doesn't decline that much at the end. And this is about 50-50. I tried a number of different trajectories and a number of different parameters, and this is what fit the best. So we're going to be predicting trajectory membership. We also did the initial stages of a mixed effects model. This project is in its early stages because we put it off because of COVID. Just other COVID projects took precedence, but you can see more time dependence for Enlighten than for AFIA and Horizons. These confidence intervals aren't accurate because I didn't account for the autocorrelation structure, but you can get the sense that the Enlighten is distinct. And this is mixed effects, by the way, with nested within people, nested within trial. Moving to reproductive coercion, this is only from the Enlighten trial. Enlighten asked about reproductive coercion, which is a concept that's been started to be measured in the past 10 to 15 years. And it is based on a 9-question scale, which has components of sabotage of contraception and coercion. And the most common reproductive coercion items I'll just show along with the percent recanting. So the most common one was, has someone you were dating or going out with ever taken off the condom while you were having sex so you would get pregnant? So about 1/3 of the people said yes at baseline. That declined enormously, and in fact, 66% recanted. So the decline from 33% to 17% is not 66%. Rather, this represents that some people initiated at 3 months, they said no at baseline, and they said yes at 3 months. The recanting is the percent of those at baseline who said they'd never had a partner take off the condom while they were having sex so that the respondent would get pregnant. So this is really a dramatic amount of recanting. And we can see the next ones, such as being told not to use birth control, forced to have sex without a condom, which is essentially rape, and broken a condom on purpose to get pregnant, are all recanted about 3/4 of the time. So this is a really enormous amount of recanting. And this scale is relatively new. It hasn't been evaluated that much in terms of recanting. Here is what a spaghetti plot where each line represents a different question. So this one is the take off the condom while having sex so you would get pregnant. This next one was, told you not to use birth control. This next one is being forced to have sex to get pregnant. So you can see that initially this is reported quite a lot. These are ever questions, right? So this is substantial. The questions usually aren't used individually, but I did want to show them individually first before I showed them as they're usually used. They're usually used either as the two subscales or as the scale together. And you can see that as, and it's coded as 1 if they report any of them, and it's recorded as 0 otherwise. So this is just a binary yes, no question. And you can see that it declines substantially for lifetime. It also declines substantially when the question is about the past 3 months. And that may represent people not engaging in less coercion or being involved in less coercion or sabotage. They leave the boyfriend who's doing this to them. So this could be entirely truthful. But the fact that the lifetime decreased so much makes me inclined to believe that some of this is really actually being concealed in these subsequent waves, because they're giving logically impossible answers by recanting the baseline reported coercion or sabotage. So what's going on here? Why is Enlighten different? What's going on? So far I've done a number of analyses and nothing predicts recanting. Age doesn't, treatment assignment doesn't, audit score, which is alcohol use disorder scale, does not predict recanting. I'm continuing to try to figure out what's going on here. One difference, and this we cannot test the effect, unfortunately, is that people in Enlighten were recruited from community settings, not clinics. And my belief, and this is only a belief, I cannot prove it, is that even though the trials aren't connected with the clinics, they still may be getting some benefit from this doctor-patient relationship that the women attending the clinics may feel. So even though all 3 interventions occurred in the same Emory University setting, they initially were recruited in a certain place and they may have an association that way. And there's more feeling of obligation to be truthful when they associate the trial with their doctor, with their clinic. There's no past research on this. I've done extensive searches and I could not find anything, which is very unfortunate. When I wrote it up in the intervention evaluation, the reviewers found it speculative, so I took it out. But I really believe that there's some element of this going on, even though I can't prove it, and I'm trying to figure out how. And I can't, because there were only about 20 people recruited in the clinics. So it's just very hard to compare these 20 people with the other 540. The life stage is different. They're a few years older, they have children and jobs. Those are very big responsibilities. They may feel a lot of pressures due to their life stage, and they just may want to shorten the survey and get through it. We can't evaluate the effect of parenthood because that was an exclusion criterion in the other studies. Maybe it's the year that respondents have gotten less cooperative over time for various reasons. That may be related. Is it their alcohol use? It seems unlikely, but it is a difference. And we've only evaluated it through the audit scale rather than any other measures so far. So in summary, recanting of lifetime incidence was more substantial in the Enlighten, the more recent HIV trial, than the Horizons and AFIA trial. And that was true for every question evaluated. And that's not just marijuana, but also these other variables. Enlighten was the first of these trials to measure reproductive coercion, and these showed enormous recanting. And further, the questions about the past 3 months also declined in prevalence, and that decline may not have been real because it was paralleling the impossible decline in lifetime incidence of it. There really are very few answers at this point. Some hypotheses aren't even testable. The bottom line, the takeaway, is that recanting is very common and measurement error is larger than researchers think, and no one wants to think about measurement error because there are often no good solutions. Questions about lifetime incidence are problematic, but even asking about the recent past, people still conceal things, it seems. Recruiting people likely to give accurate responses may reduce measurement error substantially. I believe we had a lot of trouble with noisy data in the Enlighten, and I wish that they had invested a little bit more time, even though it was really laborious, to identify more participants at clinics, at least to allow the assessment of comparability. But this didn't happen. So I'm left with my speculations. Thank you.